You'll start by assigning your patients at the beginning of your shift. This may be done by the patient list, by right-clicking your patient and assigning me. You will then go to your brain, where you'll find your patients for the day. Double-click on the brain to open up the patient's chart. Nurses can go ahead and look at the patient's chart prior to bedside shift report just to get an overview. When you pull up the patient's chart, the summary pulls up and nurse handoff report is the second tab over. This is what Bon Secours Mercy and Epic trainers recommend for any bedside shift report at any handoff. So this goes to the SBAR format that you can pull up at the patient's bedside while you are assessing and including the patient. It starts with the situation. This will be more populated once we are in a production environment. Chief complaint, medical problems, last set of vital signs, diet orders, I's and O's, all of those will be available. The background on the patient, including the avatars, are present on the nurse handoff report. This is an excellent opportunity for the nurses to look at every line, drain, or wound in the patient's room. You can also document if anything has changed from the last assessment. It also includes any overdue medications that you can address with the offgoing nurse. At the end of the nurse handoff report, there is a shift handoff report that takes you straight to the documentation. This pulls directly into the flow sheets for the handoff, where you can document the offgoing and receiving nurse. Once that is documented, you can scroll over in your flow sheets to the daily care safety. This is an excellent opportunity to look at all the safety measures in the patient's room, including all your fall risk measures, your bed alarms, if the patient is clean and dry, their mobility. Any of this can be documented and is included in part of your daily assessment. You can also look at the orders tabs to see any active orders, anything that may be missed from the previous shift that need to be addressed immediately. The brain over here on the right sidebar also allows you to put any tasks that need to be completed. For example, say you need to call the family in an hour to get consent. You can document this. This is only for you, and it populates into your work list so that you can call the family with the physician to get consent for the patient. Once it's completed, you can hit done and it removes from your work list. Any of these other tabs can be reviewed. Any narrators that are still going, like blood admin, can be addressed at shift change. The MAR is also here to see any overdue medications that may need to be addressed as well.